Good afternoon, Facebook friends. My name is Dr. Shayla Toombs-Withers. I'm the physician owner at the Essence of Health Wellness Clinic, and I just want to say happy Friday and happy Valentine's Day. So this is our day of love that us Americans celebrate and call Valentine's Day. And so I thought also by February, is the month in which we celebrate Valentine's Day, that it would also be a good idea to talk about heart health because February is also considered American Heart Month by the American Heart Association. So I wanted to talk with you all today about how to keep your heart healthy so that you can continue to love on your loved ones this Valentine's Day and all throughout the years to come. So I'm calling this chat today 5 tips for a healthy heart. Now, I want to start off by saying and letting everyone know that heart disease is the number one cause of death for Americans, and that's in both men and women. Heart disease does not discriminate when it comes to that. And so I just wanted to share with you guys a few tips as to how to keep your heart healthy and how to keep yourselves healthy so you can continue to celebrate many more holidays and occasions to come. So my first tip, which may seem obvious, is keeping a healthy diet. And so diet is a big part of keeping our heart healthy, keeping our bodies healthy, keeping our muscles strong and our bones healthy. And in particular, when we talk about a healthy diet, really a plant-based diet is really the key to having a healthy heart. There have been numerous studies out there that have shown that increasing your intake of fruits and vegetables and whole grains is actually healthy for you and can help to not only protect your heart from heart disease, but can also help to reverse some conditions that can lead to heart disease and heart failure, particularly high cholesterol or high blood pressure. A plant-based diet has been shown to reduce those instances. And so what does that look like? Well, it's really a diet where you are decreasing your intake of all animal products. So decreasing your intake of meat, poultry, seafood, dairy products, eggs, pretty much anything that comes from an animal. But in turn, you are greatly increasing the nutrients you're getting from vegetables. So thinking about dark leafy greens, the other wide variety of vegetables people may like broccoli and carrots, legumes or beans, fruits, your apples, oranges, blueberries. So greatly increasing your intake of those things. And then also those unprocessed whole grains. So those are things like brown rice, barley, farro, unsweetened oats, and all of those types of fruits and vegetables and whole grains can definitely help you to protect your heart and to prevent heart disease. My next tip number 2, is to get moving, move your body, exercise. So the current recommendations from our preventative health folks are that people get in at least 150 minutes of intentional movement or exercise per week. And so what that can look like is 30 minutes, 5 times a day. And they prefer that you have moderate activity. And so moderate activity, that can be like a brisk walk, a walk to where you feel like your breathing is labored and not like you may just be strolling in a mall, but a brisk walk, a hike, leisurely cycling for those folks in Chattanooga, just getting out there on the Riverwalk and grabbing one of those bikes, one of the rental bikes around town. That can help you reach your goal of moving 150 minutes per week. And then for my endurance athletes that are out there, at least 75 minutes a week of more vigorous activity. So that's more jogging and running. Zumba class does count as vigorous activity. People who like to do these Peloton classes, that counts as vigorous activity. And so just really getting your body moving for that 75 minutes of vigorous or 150 minutes of moderate activity a week. Also, add to that at least 2 days a week of strength training. And here's the reason why. If we strengthen our muscles, that also promotes healthy bones and prevent bone loss over time. So beyond even benefiting our heart, we're also benefiting other parts of our body while keeping healthy. Tip number 3 is regarding smoking. So if you are not already a smoker, then great job. You're well on your way, and don't start smoking. If you are a smoker, I do recommend that you quit smoking. And your doctor can certainly help you. There are certainly many methods to quitting smoking out on the market now. There are a couple of medications out there to help people quit. There is nicotine replacement type things with patches and gum to help people quit. There's a quit line, 1-800-QUIT-NOW. It's free. You can get free assistance with quitting smoking. And the reason for this is because smoking does increase your risk of heart disease. Smoking makes the blood vessels that go to the heart, it makes those blood vessels more firm and decreases our ability to pump blood adequately through our body. And it also increases our risk of heart attacks and strokes. So if you are a smoker, I do encourage you to quit. And then even those people who may be smoking e-cigarettes or vaping, we've seen a number of illnesses and a number of complications from that too. So I also encourage you to quit doing that. And just as important is secondhand smoking. So non-smokers actually have a 30% chance of developing things like heart disease or lung cancer just from being exposed to secondhand smoke. So if you're living with somebody who smokes in your home, or parents, if you're smoking in your car and exposing your children to nicotine, then that is just as harmful to them as it is to you who is the person that's smoking. So everybody just stop smoking. Tip number 4 is get a physical. Go see your doctor at least one time a year. If you're pretty healthy, if you have some other health problems, you may need to see your doctor more than that. But the reason for that is because at that routine physical, your doctor has the ability to screen you for risk factors to help you to determine what possible labs may be needed, what possible tests may be needed to actually help you to prevent the development of heart disease. Your doctor can go through your family history to know, if your mom or dad or somebody in the family had significant heart problems, which can lead to heart disease. Your doctor would also usually check your blood pressure as a part of that visit, because we know having high uncontrolled blood pressure can also lead to heart disease, can lead to heart attacks, can lead to strokes. So it's important to at least go see your doctor at least once a year. And then having a preventative lab panel. So checking things like your cholesterol, your blood sugar, because diabetes can increase risk of heart disease. So that's another important reason to go see your doctor and have that yearly physical with routine preventative lab work at least once a year. And then my last tip, actually I talked about it just a little bit, touches back on, is knowing your family history. As a family physician, I see patients all the time and I ask, well, is there anybody in your family who's had this? Or, what type of illnesses does your mom have or your dad have? Or where did your dad die from? And a lot of people really don't know because a lot of things just aren't discussed amongst families. But it is important that you discuss your family history with your parents or with uncles or aunts or grandparents if they're around, so that you are aware of what you may be genetically predisposed to getting in terms of heart disease, as well as other disorders that are out there. And that way, that also helps your doctor to know if they need to start screening you for something earlier than what's recommended, or if they should take other preventative measures in terms of your treatment beyond what's recommended, because you have this significant family history of a heart disorder, or somebody may have died of a heart attack before the age of 50. And so things like that are really important for your doctor to know to help guide your own health care. And so those are my 5 tips for a healthy heart. So remember that healthy diet, intentional movement, and exercise. Don't start smoking or quit smoking. Go see your doctor yearly for a physical, and know your family history. So thank you all for joining me. I see I have a few people who are watching today. If there are any questions, feel free to ask them. And I will respond to questions by way of the comment section, so you can look out for those answers there also. And so I do want to just wish everyone a happy Valentine's Day. I would like to guide you over to the Essence of Health Wellness Clinic website at www.essenceofhealthwellnessclinic.com. I am accepting new patients, and you can certainly join and become a member right there on the website under the membership page. For the rest of the month of February, I am still running a New Year promotion where I'm waiving the enrollment fee to join the practice. And that special will go away, though, at the end of February. So if you are on the fence and thinking about joining, then come on and join right now. And also take a look at the Instagram page at instagram.com/Essence of Health Wellness Clinic. Remember, the essence of health is in you. Thanks for watching today.